Some DFW hospitals just received supplies that they will use to administer the vaccine.
Those supplies are in addition to the ultra-cold freezers they already obtained that are required to store the doses at temperatures at least 70 below zero. Fox 4's Blake Hansen is at Methodist Dallas Medical Center with more. Blake.
Yeah, Heather and Steve, there's been this extreme level of planning that has gone into preparing for the vaccine's arrival so that once it does get here, these hospitals can begin giving it out immediately. It was an exciting morning at some DFW hospitals where shipments arrived filled with supplies that will be used to administer COVID-19 vaccines.
The ancillary supplies came in this morning. My staff texted me and said, the vaccine's here. So everybody like, oh, here we go. Well, then I had to go, false alarm.
But the boxes bearing syringes, saline solution, even documentation that will prove a person has been vaccinated are just another sign the vaccine is right around the corner. John Albrecht is managing the logistics of delivering the vaccine at Methodist Dallas Medical Center. The hospital is due to receive around 5,800 doses in the first shipment. That'll depend on when the FDA gives the green light. But once it does arrive, it'll start going out to healthcare workers almost immediately.
We should be vaccinating within hours of receiving it.
The hospital has prepared for this moment since the early days of this crisis. It started working in March to get a freezer, ultimately this negative 80 degrees Celsius freezer, which can store up to 20,000 doses.
I think we're looking forward to moving on down the road. It seems like we've been in a holding pattern for a while.
Parkland will also receive around 5,800 doses initially.
If we receive that vaccine that morning, we're planning to begin vaccinating that afternoon.
Dr. Vivian Johnson says the storage of the Pfizer vaccine is still one of the toughest parts. Once removed from the freezer, it is thawed, then diluted, among other steps. The hospital will have to make sure each vaccination is scheduled so as not to thaw too many doses and waste precious vaccines.
Out of the 30-something years that I've been a pharmacist, this has probably been one of the most complex medication management programs that I have seen in my profession.
But these hospitals are again rising to the challenge after months in the trenches battling COVID-19 both professionally and personally.
I will be receiving the vaccine because I've seen what it can do to family members, to friends.
Johnson lost an uncle to the virus last month. It is now her mission to help deliver the vaccine and help others avoid that heartbreak.
In order for us to get out of this, we're going to have to accept something like the COVID vaccine to get out from this devastating disease.
A reminder that for this Pfizer vaccine, it actually requires 2 doses taken 21 days apart. Healthcare workers are going to be prioritized in getting vaccines. As for when it might be ready for the general public, it's still hard to say, but we know that hospitals are already starting to work on the logistics for that. Steve and Heather.